chapters. In this week's post, we're talking about plantar fasciitis and debunking some of the myths behind plantar fasciitis. In the past, it's been thought that it's an inflammatory problem. In the research, for a long time, you really actually haven't seen that so much. In the most recent research guidelines for physical therapy that actually was updated in 2014, we started seeing some inclusion for trigger point treatment added to treatment for plantar fasciitis, which actually showed some pretty significant outcomes. So you saw improvements in pain, function. One of the big ones that snuck in there was the time for recovery, especially with patients who were treated with dry needling. So the point of this week's blog is just to show you some techniques that can help you speed up recovery. In the past, treating plantar fasciitis has been more about taking some time off, stretching, maybe some night splinting. People also used to get cortisone injections into the foot, which hasn't really shown any real value. So what we're going to do today is go through some techniques to look at the primary spots that usually need some love when you were trying to get rid of this foot pain. All right? So let's go to the image. So looking here, just a little overview of the muscles. You got your gastrocnemius right here, big muscle on top. A lot of times you can really just kind of pinch this muscle on the side when you're trying to treat it. Then underneath of this, you have your soleus. All right, so when you're going through the soleus, just applying some pressure with the fingers or a ball will often do the job. And then at the bottom of the foot, you can treat this area to kind of get some relief. Right here, you can't see the muscle we're necessarily going after, but the Quadratus Plantae is a muscle underneath the flexor digitorum that often refers to the heel. The gastroc will also refer to the bottom of the foot, as will the soleus. So let's knock these out. So first things first, before you get too far into this, you need to know the techniques for treating trigger points. I posted this in some of the previous videos, and I also included a free little diagram that goes through how to treat these areas. So first muscle we're targeting is the gastroc. Like I discussed in that picture, we can go and we can grab right on the head of that gastroc and pull it off. So we're running our fingers across the fibers looking for a nice taut band. When we find a tender area, right, we search up and down. Right, so find the most tender area, then from here, contract the muscle 10 seconds. Relax, let my fingers sink in for about 20-30 seconds or feeling like the muscle relaxes, and then I'll repeat that about 3 or 4 times. Next area to go into is the soleus, which we talked about is a little deeper. So we can run our finger or thumb across these muscles, feeling for a nice tender taut area. So I got one right here, so when I find it, I'm going to work up and down it, seeing which area is the most tender, reproduces some of my symptoms. I'm going to do the same thing here, treating this area. Okay, next thing you can consider is something I saw on Mobility WOD. So I love Kelly Starrett's stuff. In the past, he's used the Gemini to do a little bit of twisting technique in the fascia. As we talked about before, the fascia can have a huge component or impact on the foot. So the fascia covers the muscles, it kind of intertwines everything. It's not a really pretty looking picture like the one I showed you. It's really a lot of messy muscles and attachments of fascia which looks like spider web. So in clinic what we do is we try to manipulate that fascia above and below the area that we're treating just to take some pressure off that painful site. So you can do a little twisting technique here where you go in on that trigger point, you twist up the tissue, and then you just kind of repeat that contract and relax cycle. Another thing you can do is take the ball if you don't want to use your fingers, especially if you need a little more pressure, and you can do the same thing, find a nice spot, sink in, do your contract, relax. Last spot I want to talk about is the bottom of the foot, your Quadratus Plantae, which can refer some pain to that heel. So what you can do is get right on that spot, same thing, find a tender spot, something that reproduces your symptoms, and then from there what you'll do is you'll contract the foot again, and then relax, let that ball sink in, 20-30 seconds, trying to get the muscle to relax. You can also do that little twisting or smearing technique of the fascia that we just talked about, so you can twist up the fascia and then apply your pressure. All right, so that should do it. Hopefully that kind of knocks out your plantar fasciitis way quicker than it may have in the past. I really hope it helps. If you have any comments, feel free to put them on the blog or on the YouTube video, and I'm always here to help. See you next time.